Welcome to another edition of the dynamic editorial for the JACC Cardiovascular Imaging. My name is Dr. Chandrasekhar and I'm one of the associate editors of the journal. Today we're going to talk about using novel imaging technologies to evaluate peripheral arterial disease. And my guests are Dr. Jonathan Lindner from the Oregon University and Dr. Chris Kramer from the University of Virginia. Welcome. Dr. Lindner, tell me about this paper, and if you also can address what does this tell us about things that we so far don't know.
Well, it's a pleasure to be here with you and Chris. The premise of this study was that perfusion imaging of limb skeletal muscle would give us additional diagnostic information in patients who had peripheral vascular disease, namely peripheral arterial disease. The current techniques that we have for evaluating disease are perform well, but there are certain populations that it does not perform all that well in, including the elderly and the diabetic populations in whom microvascular disease is more common. And so the premise of our study was to apply contrast ultrasound perfusion imaging in the skeletal muscle and to apply what we know in coronary disease to do stress-rest perfusion imaging to assess abnormalities in exercise stress and flow reserve during exercise. And so what we did was we took normal control patients as well as peripheral arterial disease patients and peripheral arterial disease patients who had diabetes, who are more likely to have microvascular abnormalities. And we assessed them with conventional techniques such as ABI, post-exercise ABI, and pulse volume recordings. And we determined their claudication threshold by doing a modified treadmill test to evaluate how symptomatic they were. And then we applied the contrast ultrasound perfusion imaging at rest and stress while imaging the calf muscles during plantar flexion exercise.
That's a very novel way of applying ultrasound. Dr. Kramer, you wrote an editorial on this. What did you like in this paper?
Yeah, I think in peripheral arterial disease, there are a lot of holes in our understanding of the physiology in exercising muscle. And there are issues with finding novel therapies for medical therapies for treatment of patients with peripheral arterial disease. And one of the limitations of finding therapies is the lack of quantitative reproducible endpoints for clinical trials. And I thought this was very interesting as a potential quantitative technique that could be used for developing novel angiogenic agents or other novel therapies in patients with peripheral arterial disease. There's a real need for quantitation in this disease process.
That brings us to the most important point with any test. How do we know what we are measuring with ultrasound is actually blood flow, and how do we establish that it is something valid and useful?
Yes.
What's the background?
Yeah, so in peripheral vascular disease, there is no real gold standard that is conventionally used for evaluating tissue blood flow. And so what we did was we first validated this perfusion imaging technique, first in the heart, but also in the periphery, using animal models of peripheral vascular disease. We've used mice, rats, and canine studies. And we've compared our data to other gold standards for measuring blood flow, such as radio-labeled microsphere techniques.
So it's pretty well established that it's a very reliable technique.
Yes, and in humans, the technique has been validated also against PET.
Okay. Dr. Kramer, you're an expert on CMR. And CMR and this area will obviously be competing for the same territory. How does CMR perform in the same subset of population?
Our group has been performing parallel studies to Dr. Lindner's using first pass exercise stress contrast-enhanced perfusion imaging of the calf muscle. And we always relate it to arterial input because obviously a patient with reduced ejection fraction, the contrast is not going to get there as quickly. So we have a mechanism to do exercise in the scanner and measure first pass perfusion in the same way one would do it in the heart. And it's a technique that in our hands has differentiated patients with peripheral arterial disease from normal subjects quite well. Because it requires contrast and there's concern with patients with PAD and low GFR, we're also working, as our other groups, on non-contrast techniques for measuring blood flow in PAD with CMR.
Dr. Lindner, in a brief capsulated form, tell us how the technique is done and can an average lab do it?
Yeah, I think one of the beauties of the technique is, number one, it requires a machinery that's in place in most vascular labs, which is an ultrasound machine, which is contrast ready. We begin an infusion of our microbubble contrast agents, and I must state that this is an off-label use of microbubble contrast agents. But we begin a continuous infusion of these agents, and we measure perfusion at baseline. And using some of the more modern techniques for measuring perfusion, the real-time techniques, that only takes about 15-20 seconds. We then begin exercise with plantar flexion exercise for 2 minutes, and then can measure the stress perfusion imaging while imaging the calf muscles. And so really the whole stress rest perfusion imaging is, does not take that much time, and is not that much more difficult than doing a Doppler study. Of course, it does require some specialized training in contrast administration and how to image the bubbles in tissue.
Okay, quick last 30-second comment. Where do you see these techniques being applied? Dr. Kramer first and then Dr. Lindner.
Yeah, I think the first application will be potentially in clinical trials to have a quantitative measure of perfusion and the development of new angiogenic agents and other novel therapies in PAD.
I agree completely. I think that for today's medicine, I think that the ABIs and PVRs perform pretty well, but for what we want to do tomorrow, you know, the therapeutics that are on the horizon, I think we need much better and more precise methods for measuring actual tissue perfusion, which is our end organ for damage in PAD.
Well, thank you very much, gentlemen. I think that's a very exciting area to work in, and we'll see whether CMR or ultrasound takes the lead in this. Thank you very much and I hope the audience found this to be useful too.